this morning. Physical activity is one of the best things we can do to improve our overall health and help us live longer. But people that don't exercise are at risk of serious health issues like heart disease, type 2 diabetes, obesity, some cancers. Haley, come on, we all know this, but
we all know that exercise is good for you, right? But I mean, any movement is better than no movement at all. And a lot of people underestimate that if they can't go to the gym for an hour, they're just not going to do anything at all. And that's really not the answer. Physical activity can help manage chronic diseases and other complications. And joining us to explore exercise and health is Dr. David Purse with the City of Houston. Good morning, Dr. Purse.
Good morning, Haley. Good to see you.
So as Owen and I were just mentioning, we all know that physical activity can improve someone's health, but you say that there's also immediate benefit after just one exercise. Is that true?
Yeah, it absolutely is. Things that people notice when they exercise very quickly, sometimes the same day, sometimes after the second day, but a reduction in anxiety and depression, and also their blood pressure can start to come down. And then, when you work out during the day, that evening you're pretty tired and you're going to get a better night's sleep, which also helps reduce anxiety, depression, and your blood pressure. And then the other thing we find is that people, their ability to just think more clearly, cognitive function, they do better on academic tests, they do better on memory testing and mental processing. And then the other thing that we don't always worry about is our insulin sensitivity. So as we get older, we become less sensitive to insulin, and that's really one of the causes of type 2 diabetes that you mentioned earlier, but it also helps with that very, very quickly.
I didn't realize insulin sensitivity could be affected by just one session of exercise. That's really good to know. And all of those perks that you're mentioning are all the reasons that you can also just get addicted to exercising. Once you start, the starting is actually the hard part. And then once you're into it, it can be more fun as you go along. But what about the long-term benefits of exercise? What do you have to say about those?
Well, the number one and number two cause of death in the United States are heart disease and stroke. And if you exercise regularly, you're going to see, what we've measured is there's a reduction in the risk for people who exercise compared to those who don't, of heart disease and stroke. And then the other one we talked about just a moment ago was type 2 diabetes, which comes along with, as we age, we become less sensitive to the insulin that our pancreas secretes. That's basically what type 2 diabetes is. But by exercising, we increase that sensitivity back to normal levels. And then something else that you mentioned earlier, which most people don't recognize, is that physical activity can reduce your risk of certain cancers. And the list is actually fairly long, but just briefly: bladder cancer, breast cancer, colon cancer, kidney cancer, esophagus, lung cancer, cancer of the endometrium and stomach. These are all reduced by regular exercise. And then the other thing, of course, is we worry about, as we get older, our functional limitations. We get a little bit stiffer. We get we get problems just doing activities of daily living. Well, if you are exercising regularly, you tend to not have as much of that as you age. So these are all long-term great benefits from exercise.
Dr. Purse, before I let you go, tell us the main type of exercises that you as a doctor would recommend, and how long should we do it?
Yeah, so really good. When we think of exercise, people often think of one or two of the forms, and there's three. One is aerobic exercise. You know what that is? That's jogging, that's running, that's walking, bicycling, things to get your heart rate up and going. The other one is muscle training. So this is with lifting weights or using resistance bands and working on your muscles to strengthen them, if not to build them. And then the one that most people forget is flexibility exercise. So this is the stretching that you need. That is really, really important as we get older, in particular, so that we can, again, that functional ability as we get older. And then how much you need to do? Well, it kind of depends on age. Kids can do a whole lot more, so they should be exercising up to about the age of 18, 20, 21, about an hour a day at least. For most adults, it depends on how vigorous you're going to exercise. If you're going to vigorously exercise, an hour to maybe 2.5 hours a week is all that's needed. And if you're going to do less vigorous, 2.5 to 5 hours. And then older folks, maybe not so much with the intense exercise, but really do those things that are going to work on your balance so that you don't fall. We avoid hip fractures, we avoid wrist fractures, we avoid other things if you get your balance in shape.
That's perfectly said. Thank you, Dr. Purse, for joining me. And just as a reminder, everybody always thinks you got to do the aerobic exercise. You hear exercise, you think running, but yeah, that's strength training and stretching, really important. So thank you for mentioning those this morning. That's Dr. David Purse, Chief Medical Officer with the City of Houston. Owen?